I'm Joe Chili, weekday morning, 7 to 9 on Buffalo's oldie station, the Big Weck. Joining us today on Buffalo on the Rise is Dr. Christian Miliotto from WNY Pain Relief. Welcome.
Thank you.
How you doing today?
Fabulous.
You're doing fabulous all the time. You know, and that's part of the reason why people come see you, because they want to feel fabulous too, right?
That's 100% true.
Let's talk about chronic pain, and that people, not just me, I could be a chronic pain, but the pain that people are experiencing all the time, and they think, it's just something I have to get along with because of my age. Mm-hmm. But now you can help people with pain like that, and curing might be a different situation, right? Depending upon age and how long they've had this pain or whatever.
Well, it really comes down to a simple thing. If you're dealing with chronic pain, that means there's something wrong in your body, okay? Now, yeah, some people might opt out of things like surgery. Maybe they don't want to get a hip replacement, or they don't want back surgery, or they have chronic knee issues, But the realistic aspect of the nature is the way our medical umbrella is most of the time when it comes to treating these conditions, most people go under pain management. If you seek alternative care, chiropractic, physical therapy, acupuncture, etc., you could see some clinical benefit, but then usually they kind of plateau. And the reason why they plateau is because the root cause of the problem is not being addressed, okay? Now, in our office, a lot of people come to us and they say, you're my last resort. I saw you. This is different. I'm a little nervous. There's nothing to be nervous about. There's no negative side effects in any of the therapies we do, but they are designed to accelerate the healing process of a tissue, okay? Medicine will never, ever, ever use the word cure, but that does not mean that a patient hasn't come into my clinic who is 75 or 80 years old and couldn't stand or walk, and by the end of their treatment plan, told me they feel like their pain went from a 10 to a 2 and they have a normal back, normal soreness. We all have normal soreness, but that stuff that goes away, that's your body being able to heal, and that's what our technologies do.
I want to know this. Have you ever walked out into your waiting room, see somebody with like their leg flung over the arm of a chair and they're kind of slouched down there sitting there, yeah, and they're complaining about pain or something like that, yeah, and you say, the way you're sitting is part of the reason. Does that ever happen?
Well, when we're in pain, we actually sit in what's called an antalgic posture. So your body will favor taking yourself away from the pain. So when I'm working with people, I can figure out what's going on with disc and nerve disorders related to your neck or back, or nerve conditions going into your arms, hands, legs, and feet, just by the moment you walk up and I bring you into my consultation room through the conversation before I even look at your MRI. And then I draw it all out and I show them, and the patient's like, how did you figure that out? Well, our body has things called dermatomes. We can follow these nerves. And we need to alleviate the new you that your body created. Your chronic pain has changed your quality of life. It's affected how you stand, affected how you walk, sleep, and function. And your body now thinks this is the new normal. But you can break that chronic pain cycle. And the biggest thing I always explain to people to understand is, so let's say you're experiencing neuropathy symptoms in your arms, hands, legs, or feet, okay? So you have numbness, burning, or tingling, or balance issues. Well, why do you have it? And then some people might be a diabetic, or they've undergone things that have changed circulation. But is there a problem with your spine? I can't tell you how many people I get from a very large neurologic suite that we won't name for respect, where they come in and they're diagnosed with X, and then I look at their imaging and I say, hey, did anybody talk to you about this MRI that they did? And they go, no, I had it the same day, but nobody ever mentioned it to me. And these things have to be appropriated. When you treat a person, you can't treat them by a diagnosis. You have to treat them by who they are and what their pain is and how it developed, and then what's inside their body that's causing it. That's what you get out of our care. And that's why it doesn't matter if a patient comes in that's in their 80s and they've had multiple surgeries and pain for 25 years. I've been able to restore function. Go to my Google reviews, watch my testimonials, and you will see people who have seen it all and done it all. And when they came in, they felt that there was no hope. And within 2-3 months, we gave them their life back.
What about, I notice as people get older,
yeah,
they start to walk a little hunched. Mm-hmm. you know, and they say, you know, I said, my grandmother would always say, stand up straight, sit up straight, or whatever the case may be.
Yeah.
And I wonder, because, they say you get shorter as you get older. I wonder if you don't get shorter, you just kind of hunch.
No,
What's
you get
the
shorter.
reasoning for that? Is that something that you can cure or work with?
Well, what happens is when you get older, your discs start to lose water. Okay, so the discs shrink, which is why we shrink. Okay, when people start to lean forward, that's called an antalgic forward posture, and it has to do with what's called a senile kyphosis. So as you get older, this spine will start to change and bend forward as your muscle mass and tissue changes and as your inflammation increases. But these are all things that should be properly addressed. And then once again, when you're treating these things, modern stuff that you do, whether you see your primary, you go see a neurosurgeon or a pain management doctor, none of them are treating your pain, they are masking your pain. So the patient has to advocate for themselves. And it's not their fault that it's taking so long to get to a proper treatment or course of care. But once they slip into that medical realm where they're on a pain pill or an injection, it's setting them up for failure. And that's my biggest problem. The patients I treat, senior citizens, younger, middle-aged, I want to change your life. I lived chronic pain. I had disc herniations. I was a surgical patient. And I saved my life with my own therapies. And I've done it for my father. I've helped him avoid surgery. I've done it for family members. And my patients are family. So the best thing you can do is help that.
So the reason that people are hunching a little bit isn't from looking down at their cell phone.
No.
I just want to make sure about that. All right, Dr. Christian Miliotto, thank you. We really appreciate it.
Pleasure.
For more information and answers to your questions, contact WNY Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional consideration for the preceding segment was provided by Western New York Pain Relief. And don't forget to join all your favorite personalities, JP, Roger Christian, Bobby O, and me, with classic oldies from the 60s and 70s on the Big Weck.